Okay, ready? So this is the first tool we're going to use, alright, on Kathleen's Morton Neuroma. And most neuromas are between the third or fourth toe or the fourth or fifth. Actually not the toes, but the metatarsal bones right here. And well, she's been suffering for over 20 years. What happens is if you wear a shoe with a too narrow toe box, or genetically your feet and toes are more spaced together than usual, the veins and arteries and nerves become compressed, and that cuts off the circulation and nerve supply. And what happens is it gets inflamed, it swells, and then you start getting scar tissue and calcific adhesions in there because of the irritation chronically, and that causes chronic pain. So some people, they have to have some surgery to take the neuroma out, which it doesn't cure the main cause of it. So now, as far as Kathleen's situation, she likes mountain running, so it's not going to help her if this is chronically irritated. In fact, eventually she won't be able to do it because of the pain and dysfunction. So what we're doing to remedy that is getting her, make sure her shoes have a wide toe box. She's most comfortable in sandals. Okay. Right now she's running with New Balance Minimus shoes, which I recommend. I train in actually Vibrams, which are the fingers. You slip on like a glove, because those are more functional shoes and they preserve your range of motion. So what I'm doing is I'm breaking up the adhesions and scar tissue in between the metatarsal bones and toes, break up that neuroma. Skin's getting red, we're bringing blood for circulation. After we break this down, then the soft tissue could form normal lines of connections, and they can contract and more smoothly instead of being all bunched up and tangled up, cutting off the circulation, causing pain and dysfunction. So what I'm going to do is get some more lubricant wax here. I just put just enough. You don't want too much or it gets all messy. About that much. Now I'm going to work on the worst side here. And so usually the golden test for Morton's neuroma is if I squeeze it. Do you feel it still? See,
not like I did.
Not before, but when she first came in, that lighted her up.
Oh yeah.
All right. But because we loosened it up, now she can handle it more. So I'm going to work on that a little more. I can actually feel it. There's a kind of sandpaper in there.
Yeah.
We just got to smooth all that out. Now this half moon tool right here, it just fits perfectly right in between those metatarsals, and we kind of scoop it out. Just like that. Scoop it out like that. I like to go to the center because that's where the crust is. So we got a